Knock, knock. Hello, my name is Sierra. I'm going to be your student nurse today, performing a head-to-toe assessment. I'm just going to wash my hands really quick. So, as I said, I'm going to do a head-to-toe assessment. Do you have any questions about that?
No.
No? Can you tell me your name?
Mark.
And your date of birth?
January 21, 1990.
Okay, I'm just going to verify that with your band. All right. And do you know where you're at right now?
The hospital.
And do you know what the date is today?
The 21st of October.
Okay. And what brings you here today?
I have a pain in my stomach.
All right. So I can tell by talking to you that you are alert and oriented to person, place, and time and situation. Your speech is clear and fluid. Can you tell me a little bit more about your pain? Where exactly is it? Can you show me?
It's right here.
Okay. When did it start?
About 12 hours ago.
And what caused it to start?
I don't know. I was eating and then it started hurting.
Okay. What are you rating the pain on a scale from 0 to 10?
4-ish, I think.
Okay. Does the pain radiate anywhere?
No, just kind of centralized.
Does anything make it worse or make it better?
No.
No? Okay. All right. Well, I'm going to continue on with my head-to-toe assessment. First, I'm just going to look at your head. Okay. You can tell by looking at it you have no masses, no lesions. I'm just going to palpate. Okay, I don't feel any masses. Do you have any pain or tenderness there?
No.
No? Okay. I'm going to shine a light into your eyes. I just want you to look straight ahead. Okay, and once more. I'm just going to see what size they are. And now I want you to take a look at my pen light and follow it in. Okay. And I want you to follow it again. Okay, your pupils are equal, round, reactive to light and accommodation, and your extraocular movements are intact. I'm just going to take a look at your sclera. They are clear. I'm going to pull down your eyes. Your conjunctiva are pink. Looking at your ears, I don't see any masses or lesions. Just going to feel any pain or tenderness.
No.
Okay. I don't know any discharge coming out of your ears. I'm just going to do a whisper test. So I want you to cover this ear. And I'm going to whisper on the side and you tell me what I'm saying.
Madonna University.
Okay, cover the other ear.
Nursing student.
Okay. Now looking at your nose, I do not see any masses or lesions. Your nose is midline. And breathe in. And again. Your nose is patent. Palpating. Do you feel any pain or tenderness?
Not in my nose, no.
Okay. Now moving on to your mouth. Can you open up? Okay, say ah.
Ah.
All right, your uvula rises with pronation. I don't see any masses or lesions. Open your mouth again. And stick your tongue up to the roof of your mouth. All right. Okay. Can you wrinkle your forehead? And smile. And frown. And puff out your cheeks. And blow a kiss. Okay, your cranial nerves are intact. Next, just looking at your trachea, it appears to be midline. Just going to do some range of motion here. Can you put your neck up and then down and side to side, and again like this, side to side. Okay, and your strength, I want you to shrug your shoulders. Okay, your strength is 5 out of 5. Next, moving on to part of your respiratory assessment. I can tell I've already done your vitals, your blood pressure, pulse, respirations, oxygen saturation, temperature are all within normal limits. By looking at you, I do not see any signs of distress, no use of accessory muscles. Your AP diameter is 1 to 2. I'll just have you turn around. And I'm just taking a look. Normally you would not have your shirt on, but I'll let you keep it on for the video. I'd be looking at your spine. Your spine appears to be midline. Your scapula are symmetrical. And I do not see any use of accessory muscles. And I don't know any masses or lesions. Now I'm just going to palpate. Tell me, do you feel any pain or tenderness?
No.
Okay, I'm going to have you take a deep breath in and out. You have symmetrical expansion. I'm going to auscultate, and I want, every time I move the stethoscope, I want you to take a breath. If you get short of breath at any time, just raise your hand to let me know, okay?
Okay.
Okay, your lung sounds are clear to auscultation bilaterally, which is within normal limits. Now you can just swing around and lay down on the bed. I'm going to listen from the front. And again, if you get short of breath at any time, just raise your hand and let me know. Okay, your lung sounds are clear to auscultation bilaterally. Going to move on to cardiac assessment. First, I'm just going to be looking at your neck. I don't see any masses or lesions. Having the bed at an angle, looking for jugular vein distension. Just turn your head to one side. Okay, and the other side. Okay, I don't know any jugular vein distension. I'm just going to feel your carotid pulses. Only doing one at a time. Okay, they are +2 bilaterally. Next, looking at your chest. If your shirt was off, not seeing any masses or lesions. I'm just going to palpate. You feel any pain or any tenderness?
No.
Okay. Just going to auscultate next. Second intercostal space. aortic, pulmonic, herbs, and tricuspid. Mitral. Okay, I'm going to do the same thing with the bell of my stethoscope. Aortic, pulmonic, herbs, tricuspid, and mitral. Just going to palpate your point of maximal impulse. Okay. Next, I'm going to be looking at your upper extremities. Just by looking, I can tell that you don't have any masses or lesions. Your color is pink. I'm going to feel for temperature. Your temperature is warm throughout. Your turgor is brisk. No edema. Moving down to your fingers. Just going to check capillary refill in each finger. Okay, capillary refill is less than 3 seconds in each finger. Put your hands together for me like this. Okay, I don't know any clubbing, so good oxygenation. We're going to do range of motion. Put your hands up like this and the wrist down. Okay, and then fingers out and in. All right, good. Next, I want you to squeeze my fingers. And now push against me. Push and pull towards you. Good. Your strength is 5 out of 5. I'm just going to feel your pulses. Okay, brachial pulses are 2+ bilaterally. Feel your radial pulses. Radial pulses are also 2+ bilaterally. I'm going to do the same exact thing, looking at your lower extremities. If I would have had a reflex hammer, I also would have tested your deep tendon reflexes in your arms as well as your legs. All right. So just by looking at your legs, I can tell that you don't have any masses or lesions. The hair distribution is even. Legs are symmetrical. Just going to feel for temperature. I'm going to move the camera a little bit. That's blurry.
It won't refocus automatically.
Okay. You can put them back on. It's fine. So the temperature is warm throughout. Your turgor is brisk. There's no edema. I want you to put your toes towards your nose, and then down, and then in, and out. Okay, good range of motion. Now I want you to do the same thing, but push against me. Up. And the same thing with your legs, push up. Okay, your strength is 5 out of 5. Again, going to test capillary refill in each of your toes. Okay, capillary refill is less than 3 seconds in each toe. I'm going to feel your pulses. These are your dorsalis pedis pulses. Dorsalis pedis pulses. And they are 2+ bilaterally. And your post-tibial pulses. also 2+ bilaterally. Now I'm going to test your sensation to sharp and soft objects. So I would like you to close your eyes. First I'll start on your face. You tell me if it's sharp or soft. Okay. Tell me if it's sharp or soft.
Soft. Soft. Sharp. Sharp. Soft. Sharp. Soft.
Okay.
Soft. Sharp. Soft. Sharp. Sharp. Soft.
Moving down to your legs.
Sharp. Soft. 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 Sharp. Soft. Sharp. Soft. Soft.
Okay, you can open your eyes. All right, that concludes my assessment. I'll take the findings to the doctor and let you know the results as soon as possible. Do you have any questions?
No.
Okay, before I go, I'm just gonna wash my hands again. All right, thank you for letting me do my assessment.